which Kajal has asked. Okay, she is asking about if the patient came with a low economic conditions who can't afford even 300 rupees per session as such. So how do you manage them? Okay, so this part basically comes under the management. So let me first address that, post which the ma'am will take over to the technical part, right? So first of all, the word, how do you manage them? Okay, itself is, Kajal, you are here? You are not there. Okay, so you can go to the recording, right? See, this word itself is wrong. Okay, you do not manage as per the charges. You provide treatment as per the condition, right? So that's a right word over here. Okay, so never ever use such kind of words where you are managing patients, you are managing people based on their economic conditions or the fees they provide, or whatever as such, right? So be it VIP, be it prime minister, be it a normal person, or be it even the people who are below the economic conditions as such, right? See, the intention over here in terms of providing you the pricing, okay, the pricing, a sheet, okay, is for the uniformity, okay, is for the uniformity, wherein people will be able to see, people will be able to trust you that yes, you uniformly treat everyone on the pricing part. When I'm saying pricing, okay, I'm not including the other parts over here, right? So you don't, they don't have that doubt, or you are not providing a benefit of doubt. Okay, you are not creating a benefit of doubt for them that whatever I am paying, is it, that charge is only for me? Has he charged or has she charged only to me this amount, depending on my dress, depending on my looks, depending on my exterior, depending on my lifestyle and everything as such? Or does she have some standardization, first of all, right? Because see, most of the time, okay, people have this kind of a doubt when they go to the doctor, don't wear this, probably he may charge higher. Why? Because they don't keep their charges in black and white. And I'm saying black and white, clear cut in writing format, right? So whenever you put in black and white, okay, whenever you put the things in black and white, that is in writing, okay, people, okay, will feel that yes, okay, this is what are your charges. If you don't do that, then they try to negotiate, right? And even put yourself into the shoes of an this thing. Rather, in fact, you go every day, right? Like probably go to market, right? And you pick up some vegetable, okay, from the vendor. So they say something and you try to negotiate. Why? Because it is not written that so and so rupees kilo, so and so rupees this thing and all these things. But at the same time, when you go to the mall, right, and you pick up any items, including the vegetables, including the fruits and everything as such, right? So what happens there? You are very clear that yes, this is the price of this item and I'm buying this with knowledge, right? That's the reason if you go to a small vegetable vendor as such, right? So अगर वो 1 किलो के ऊपर 1 किलो 50 ग्राम भी हो गया, एंड समझो 100 रुपए किलो अगर बोल रहा है, तो 50 ग्राम के लिए अगर एक्स्ट्रा चार्ज कराए, तो you feel somewhat not comfortable, right? अरे रहन दो ना, छोड़ दो ना, 50 ग्राम क्या होता है, वैसा है वगैरह वगैरह, because somehow you do not have that satisfaction of paying it. But at the same time, when you go to the mall, what happens? Okay, they have that digital weighing machine as such. Okay, so you pick up anything, okay, and go there and give it, and definitely it is not exactly 1 kilo, right? Okay, you pay as per that थोड़ा सा 900 ग्राम का भी अगर आ गया, 1100 ग्राम का भी अगर आ गया, 1200 भी आ गया, तो as per that they'll charge it, and you don't absolutely bother, right? That's how the fairness basically, helps people trust you better. And they help you, creating that unnecessary negotiation nahi hoga, and they have a satisfaction. That's one. When it comes to 300 rupees, the rate as such, please understand, it is not standard, right? Ki 300 hi karna hai. See, it may vary depending on the city, depending on what kind of an probably the resources you have, or it could be, you can reduce that. That's not a problem. Okay, and not that ki 300 rupees, yes, you can keep it, and for some people like this, you can always give the discount, right? That's the most important, that that basically comes under the nobleness. Nobleness, as I mentioned, is a quality of showing that empathy, right? So you can give some discount as such, like 10% agar de diya to usme 30 rupees kam hoga, 20% discount diye the to 60 rupees kam hoga, 30% doge to 90 rupees kam hoga, and all those things as such, right? Now I am coming to the most important part, right? Now you are saying that economic condition se hai to 300 afford nahi kar payenge. Fine, agreed. तो 300 से समझो आपने उसको 100 कर दिया, या 150 कर दिया, या 200 कर दिया, राइट? और उसको आपने 2 सेशन दिए, 3 सेशन दिए, राइट? So do you think you get a result, right? My question to you here is, even जो उसने 300 रुपए भी दिया हुआ है, समझो आपने, राइट? जो समझो 3 सेशन लिया आपने, भले ही उसको 100 रुपीस में दिया, 3 सेशन दिया, if you are not able to give the results, जो 300 रुपए भी उसने पे किया है ना, that is also a problem, or that is also higher, okay, on his side, and you do not have a right to take even that amount. Why? Because the condition did not demanded 3 days. The condition demanded 30 days, but just for a case of like economic का केस है, या ये केस है तो इसलिए मैं डिस्काउंट दे दिया. तो see, by giving discounts, don't think कि I am making a favor on them and I can treat like anything. No, the treatment quality should never be different, right? It should be same for the Prime Minister, it should be same from the economically low development, low conditions people and all those things as such, right? There should not be compromises as such in terms of a treatment. What you are probably giving is some kind of a discount, okay, but even with that discount, if you are not able to give the results, just because compromising with 3 days 5 days वगैरह वगैरह करके, ठीक है, then I would suggest do not go for such kind of an compromises. Rather, you should educate them and set the expectations, right? So don't worry about the amount as such. You can मैंने शायद समझो अगर मैंने डिस्काउंट दे भी दिया, बट अगर आपने ट्रीटमेंट ये पूरा कंप्लीट नहीं लिया, तो जो पैसा आपने डाला है वो भी वेस्ट जाएगा आपका, ओके? वो भी जैसे कि पानी में डालना, ऐसे बोलते हैं उसको, राइट? पानी में डालना मतलब क्या होता है? पानी में जितना भी डालो बह के निकल जाएगा. So only you gain and they won't be able to gain on that part. So very important that set the expectation very very clearly ki if you go for this treatment, this duration is a must, and for this duration you are charging the whole of the amount. Never go for a session wise, it won't give you any kind of these things, okay? अगर मैं अगर बोल रहा हूँ नेवर गो, तो इसका ये लक्ष्मण रेखा मत समझना, इसको कि कहना मत जाओ. इन द सेंस यू कैन ऑलवेज टेक सम कॉल दैट हाँ, एक आधा बार ले लिया, एक दो पेशेंट ले लिया वगैरह वगैरह, डिपेंड्स. बट थिंग इज focus on the delivery, focus on the treatment results, so that they will be able to get the results and you will be able to get pay for that, right? So I hope I have made it clear, okay? अगर आपने 300 का 100 लिया ठीक है, और उसको 3 सेशन दिया, 5 सेशन दिया, जबकि वो हारे का केस है, तो क्या फर्क पड़ने वाला है? बताओ मुझे, उसको 5 सेशन से, 3 सेशन से, राइट? और उसको डिड ही गॉट दैट रिटेंशन इवन दिस थिंग्स, और फॉर्मेशन, तो हैबिट फॉर्मेशन तो हुआ क्या, हैबिट रिटेंशन तो हुआ क्या, यू नो, फिजियोलॉजिकल चेंजेस तो आए क्या उसमें, सो दैट ही विल बी एबल टू कंटिन्यू दैट, राइट? So that way you cannot run the practice, that way you cannot be able to give the results, and that way you cannot make someone's life better. Okay, the for a physiological change to happen, you need that time. Okay, and you need that duration, so that they'll be able to get the results and you'll be able to make them give the results as such, right? Yeah, Kajal says yes sir, I got it, thank you so much.